So here's another larger socket than the previous one. So now we've filled up the socket with bone graft particles, and we've cut up a HeliPLUG into little discs like we've shown in some of the previous courses. And we're going to go ahead and just place that into the socket. We're going to layer it one by one. And once we've added enough of those, we've kind of sealed up the top of the socket or put a lid on the socket, and then we can go ahead and suture. And the way we suture something like this, I call this the basket suture. So we start with kind of an interrupted suture. This is basically a continuous suture where we're not going to cut the free end. Okay, so it's still all one piece. We started here. Now we're just going to go back and forth across this socket. So by the time we're done, we've picked up bites of the socket about every 3 millimeters or so, and these straps of suture are sitting over the top of the socket. They're holding the HeliPLUG in place, and they're going to be there for this first 10 to 14 days until we take them out. By then, we have a mature granulation tissue that's formed underneath this dressing. A couple questions from Dr. Bainon is, what do we do about the ends of suture? Is it going to irritate the patient? That's a great question, and it really depends on how long you cut the end of the suture. And so with, say, chromic gut, if we cut it and it's, say, 3 to 4 millimeters, it's going to be just fine. It's going to drape. It's going to break down and get soft after a day or so. So we don't really see irritation with that. Where we do see irritation is with some of the synthetic materials in the bigger size. So if we're using a polypropylene or a nylon suture, if it's any bigger, meaning 3/0, 4/0, even 5/0, since that's a synthetic that doesn't break down, depending on the angle that you cut it with your scissors, you can actually create a very sharp tip microscopically, and that can kind of irritate the tissue. So with those type of sutures, we're usually using 6/0, 7/0. But great question. And Dr. Al-Rusan is asking, does the suture penetrate the dressing, the plug? It does. In this case, I'm actually picking up little pieces of my plug. I'm kind of suturing the plug into the socket. And that takes a little bit of trial and error. But if you start to use a little elevator, like a little small elevator, you can kind of hold down, or your assistant can hold down the plug while you pass through. And so it's both strapping and picking up the suture. Another great question by Dr. Cermak is wondering, why would we use a dressing like a HeliPLUG instead of a collagen membrane? That is a great question. It really depends on how many walls of bone we have. But if we have good walls of bone around the socket edges, then we're usually okay to just put a dressing on top, helping the granulation tissue and the clot mature, knowing that it's going to dissolve away. If we had a missing buccal plate, that's a criteria where we need some sort of a longer lasting collagen membrane. And that's something we'll go into in detail next week.